And we are now back with pictures there in Houston where the flooding continues. We're looking at this contaminated water, Dr. Saphier. You have people who are desperately trying to figure out what to do in this situation. You also have volunteers who are desperately figuring out how to help. You have people in Houston who are leaving their homes that were untouched, thankfully for them, but they're going to those shelters. Do you have any precautions that those people, those volunteers might need to take before heading out to those shelters?
Well, let's remember the #1 cause of death when you have a serious storm is drowning. And there's still a lot of water there, and even the strongest swimmers can drown in a foot of water. Water can flow, so if you don't have to be in the water, stay away from the water. Make sure you're with someone else. Having volunteers go out alone would not be safe. Make sure they're in a buddy system. You want to make sure they're very safe. Boots, if you have any rubber boots to really try and protect yourself, not only from the shrapnel, but also the bacteria, the viruses, and the chemicals in the water, extremely important. And as they go to the shelters, as I've mentioned, you have over 40,000 people in about 200 shelters. That is massively crowded. That's like taking the E-train across town on a busy Monday morning. That is going to be a breeding ground for infection. A lot of people have cuts, a lot of people have bruises. You're going to see a lot of staph infections, and you're going to see a lot of GI bugs, respiratory bugs. It's going to be a mess.
And having said that, Dr. Saphier, not to seem callous at all, but would it be a good idea for volunteers who are leaving their homes to go to those shelters to help? Would it be a good idea for them to wear rubber gloves?
Absolutely. Anything you can do to try and stop the spread of infection would be very, very important. As I mentioned, the biggest cause of concern right now are wound infections, staph infections, just being contaminated with the water. So touching with your hands, the bacteria on your hands could actually infect my wound because I'm not used to your bacteria. So gloves, even masks potentially, and making sure that you are really washing hands is going to be key.